Welcome to Dr. Mankads Homeo Clinic. Cancer. It's a disease. The moment we listen this word, and the next moment, the immediate thought is that hope. It's not positive, at least in ourselves or in our direct family members. But increasing incidence of cancer cases these days are really something which is extremely worrisome. We can consider that there was a time where there were quite a good number of increasing cases of diabetes, where almost in each family or almost in each at least extended family there has to be one or two diabetics. But nowadays the condition is there that in each extended families there are at least one or two cancer cases, and unfortunately we are still very less able to cope up with it. When it comes to a modern medicine, they have tried and reached a lot with increasing and finding new and new doses of the chemotherapy agents, new and new radiations. They have also tried to found the techniques for the diagnosis of the cancer in a very earlier phases, but yet at the same time none of them remains effective in huge number of cases every day. If you will see a number of cancer hospitals, increasing number of cancer hospitals in the society, you will find the same, that in spite of all the infrastructure available, still we are unable to cope up with the cancer cases. Homeopathy is fully equipped with a lot of resources, lot of medicines in the cases of cancer. शायद उसके लिए जितना हमें पेपर पे रिसर्च बताना पड़े, उतना पेपर पे रिसर्च हर एक होम्योपैथ नहीं बता पाया, जिससे शायद आज भी कई बार लोग उसको स्केप्टिकल आइज से देखते हैं, क्या होम्योपैथी काम कर पाएगी. बट लेट मी टेल यू, with our experience, whatever we have, with a lot of number of our colleagues experience, with the experience of our senior sirs and teachers, we have very commonly seen that with the help of homeopathy we have prevented cancer, we have cured cancer, and we have helped a patient to come out of the side effects of the cancer. In all these areas, homeopathy has played very vitally, very essentially and very firmly. And I am not saying this just based on a few books. I am saying this after years of clinical experience of mine and of my colleagues and of my senior teachers. So in cancer, when it comes to cancer, कई बार लोग हमें फोन करके बोलते हैं कैंसर में होम्योपैथी की क्या आप होम्योपैथी से कैंसर मिटा सकते हो, कैंसर में होम्योपैथी ની દવા હોય, એવું લોકો हमने पूछे. तो here the answer is see, it's not like yes or no. If I would rather say yes, it's not wrong, but at the same time दवा होना मतलब a lot of things in the cancer. Number one, the scope of homeopathy can be further divided into the parts. That is, उसमें number one is जो भी कैंसर केसेस ऐसे हैं जिसमें सिर्फ सर्जरी ही करना एसेंशियल है, उसके बाद में जो कीमोथेरेपी दी जाती है वो सिर्फ और सिर्फ एक प्रिवेंटिव बेसिस पे या रिकरेंस ना हो उसके बेसिस पे दी जाती है. वो सारे केसेस में रेडिएशंस या कीमोथेरेपी को अवॉइड किया जा सकता है अगर कैंसर पेशेंट अगर होम्योपैथी में पूरा फेथ दिखाए और वो अपने आप को होम्योपैथिक डॉक्टर के पास सरेंडर रखने को तैयार हो. बीइंग वेरी फ्रैंक, आई एम सेइंग दिस, that or being very open, I am saying this may be debatable, but I am saying this very rightly and statistically true as well, that जितने लोग सर्जरी करवाते हैं कैंसर में, उसके बाद में कीमोथेरेपी रेडिएशंस लेते हैं, उसमें से भी कई सारे लोग ऐसे हैं जिनकी या तो कीमोथेरेपी और रेडिएशंस की वजह से डेथ होती है, या तो उसकी साइड इफेक्ट्स या कॉम्प्लिकेशंस की वजह से डेथ होती है, और अगर कुछ नहीं होता, पूरा कीमोथेरेपी रेडिएशन चला गया, उसमें से बाहर निकल गए, पेशेंट हेल्दी हैप्पी हो गया, तो उसके बाद में भी इनफ अमाउंट ऑफ चांसेस ऑफ रिकरेंस आ देयर. सो वापस से रिकरेंस तो होता ही है. This is something which we are seeing in our everyday practice, day in and day out. So the point here is, I am not against the scope of any of the modern medicine practices. They are mandatory when they are needed. But at the same time, I strongly suggest that at least homeopathy is having a strong scope here, that if your cancer tumor can be removed, and if it has not metastatized to a lot of other places, and if lymph node in which if it has traveled, that has also been removed, then you can sure continue with homeopathic treatment and you can get rid of the cancer and you can re-energize and revitalize your life. This is one scope of homeopathy. The other scope of homeopathy is, suppose it's the right scope that the metastasis and the spread of the cancer is at an extent where chemotherapy and radiation is mandatory, then with chemotherapy and radiation, the homeopathic medicine can play a very, very important role in both the dimension. One is reducing the dose of the chemotherapy and radiation, and the other thing is to reduce the side effects or after effects of chemotherapy and radiations. I have just seen a case. I am very happy to share this. I have just seen the case just before 2 weeks, that there was a lady came to me with a cancer breast, and she had gone through a surgery, and then she is at this point of time she is under chemotherapy, and she has lost all her hairs right after the first dose of chemotherapy. All hairs were lost, all. After 3 weeks there was another dose, and after 3 weeks there was a third dose of her in chemotherapy. Before even the second dose of chemotherapy started, she started to regain her hairs. So this is how, and I won't say this may happen in each case, but the idea is this is what the potential of the sweet, wonderful, harmless pills of homeopathy. I would like to convey this message if any oncologist or any modern medicine practitioner, there are a lot of my friends as well, my seniors as well, my colleagues as well. If you are listening to it, if you are watching this, then I strongly recommend that if you feel that a person cannot handle the chemotherapy or radiations at a required dose, please refer it to a homeopath, any homeopath you know, because this is what is there in our scope. And ultimately we all are in today's time, it's an integrated time. We all are in the dilemma that we need to give an improvement to a patient. Nobody is 100%. Neither we are 100% nor any other branch is 100%. The same may be a scope of Ayurveda as well. So the point is that this is a scope of homeopathy, that in chemotherapy and in radiations, homeopathy can help in reducing the side effect. So if you are taking chemotherapy and radiation, please take the homeopathic treatment along with that. The third scope of homeopathy, दोनों खत्म हो गए, कीमोथेरेपी भी खत्म हो गया, सर्जरी भी खत्म हो गया. थर्ड स्टेज इज रिहेबिलिटेशन. अब वापस से रूटीन लाइफ शुरू करना है. There also homeopathic medicines can help like anything. It will give you in a way a re-appetite. It will revitalize your life, your soul, your vitality after your whole struggle of cancer. And also it will help you in the prevention as well. अच्छा, इसके अलावा एक स्कोप है जहाँ पे अगर व्यक्ति की एज ऐसी है कि वो कीमोथेरेपी या रेडिएशन नहीं ले सकते, अगर व्यक्ति की एज ऐसी है कि वो ऑपरेट भी नहीं करवा सकते, अगर पर्सन की परिस्थिति एज और फिजिकल हेल्थ के बहुत सारे ऐसे डायमेंशंस हैं जिसमें आप सर्जरी नहीं करवा सकते या कीमोथेरेपी नहीं ले सकते, या एक डोज के बाद कुछ ऐसी इफेक्ट्स आई है कि डॉक्टर बोल रहे हैं कि अब हम आपको अगर आगे नहीं ले जा सकते कीमोथेरेपी में, आपके प्लेटलेट्स गए, आपके WBC गए, तो इवन इन दोज केसेस you opt for homeopathy as soon as possible. I'll again repeat it with the same tone, that as soon as possible. I'm saying this with a bit of higher enthusiasm because we know that we are having the weapons to fight with your cancer. The only thing need is that we need your faith, we need your surrender, we need your conviction to start a homeopathic treatment for the cancer case. So in those cases where there is a palliative treatment, maybe in few cases, very sadly using this word, but maybe death is inevitable. When a person is now may lose his life after a couple of months or after a couple of weeks or after a couple of years, the doctor may say this, your onco may say this. So even in those cases, to give a better quality of life and to extend a lifespan as much as possible, in the cases of bone cancer, to reduce the pain as much as possible, homeopathy can help very, very significantly. We at Dr. Mankads Homeo Clinic will be very, very happy to serve you, very, very happy to help you. If any of you or who is watching this, any of your family member, if it is having this, and if you are saying this, that I am coming to our clinic, your clinic, will be more than happy to serve you, to help you. And not only through us, but through a lot of other people, lot of other senior homeopaths. I am saying, conveying you this message that please don't forget to opt homeopathy in the cancer case. Before leaving you on this video, one very, very important thing I would like to convey. Dr. Mankads Homeo Clinic is a comprehensive cancer care center. It's the integrated approach. See, cancer is something which needs a multifaceted improvement or curative aspect user disease. वो सिर्फ कोई एक ही थेरेपी से नहीं मान जाएगा, उसके लिए हर जगह से उसके साथ पेशेंट के साथ रहना होगा. एट डॉक्टर मांकड्स होम्यो क्लिनिक हम लोग मेनली जो चीज़ों पे ध्यान देते हैं, सबसे पहला तो होम्योपैथी, एंड वी आर fortunately expert enough and authentic enough in practicing it. The other is the most important is the music therapy, because music therapy से कैंसर में बहुत सारा healing होता है. And me, Dr. Parth Mankad, myself, being a part of a team of a euphonious healing music therapy clinic and research center, we are working as a music therapist for cancer care. So at Dr. Mankads Homeo Clinic as well, as a part or as a subset of the euphonious healing in the cancer area, we are also providing a music therapy to our patients. So music therapy will also help you a lot in reducing the side effects of the chemotherapy and radiations. So homeopathy, उसके बाद हम लोग music therapy भी cancer patients को देते हैं. उसके साथ साथ the third important thing is, ये जो सारी cancer की जो चीज़ें, जो दवाइयाँ, जो stress cancer का physical और mental दोनों जिसको लेना है, वो आदमी खुद है, वो व्यक्ति खुद है. उसका vitality, उसका energy, उसका inherent will जितना strong होगा उतना हेल्प करेगा. और उस विल को स्ट्रॉन्ग करने का, उस एनर्जी को स्ट्रॉन्ग करने का काम करती हैं कुछ एनर्जी साइंसेस. एंड वन वेरी इंपॉर्टेंट एनर्जी हीलिंग साइंस इज अ रेकी. इन आवर टीम आर लीडिंग होम्योपैथ डॉक्टर ग्रीवा मांकड, शी इज ऑल्सो प्रैक्टिसिंग एंड टीचिंग द रेकी टू द पेशेंट्स. So if somebody is taking the treatment in the cancer, and somebody feels that I need throughout a positivity around me, I need that my operation should remain successful, I need that chemotherapy should not harm me much more. So to create your subconscious reception healthier, Dr. Griva is with her Reiki energy always there for you. You just need to, even in this website, you can find this Reiki consultation area. You just need to go there. You just put your query there. You just put your need there, and she'll immediately revert back. And as you must be knowing that Reiki can be given directly, but equally effectively Reiki can be given through distance as well. So even if you are at any place in the world, Dr. Griva can help you through her Reiki channel and through her Reiki energy. If you are living nearby, if you are in the rehabilitation phase of the cancer care, I will strongly advise that you should you should learn Reiki from Dr. Griva, so that you yourself can give Reiki to yourself, and you can heal yourself. आप अपने आप को खुद को भी रेकी दे सकते हैं और अपने आप को अच्छा कर सकते हैं. तो उसके लिए आपको डॉक्टर ग्रीवा को कंसल्ट करना है, उससे रेकी सीख लेना है और उसके बाद में अपने आप को रेकी देना है. तो वी डू दैट एज वेल। कई बार ऐसा होता है कि पेशेंट खुद अपने आप से टूटा हुआ होता है, वी डू अ राइट काउंसलिंग टू देम एज वेल। एंड द पार्ट विच इज़ अगेन मोर इम्पोर्टेंट, कीमोथेरेपी, रेडिएशन, कैंसर सब जब जा रहा है, सब स्ट्रगल चल रही है, तब डाइट जितना अप्रोप्रिएट जाएगा, रिजुविनेशन उतना करेक्टली होगा। सो वी गाइड द कैंसर पेशेंट्स in the dimensions of the diet as well. So ये जो है वो सारी चीज़ों को एक साथ हम लोग डॉक्टर मांकड्स कॉम्प्रिहेंसिव कैंसर केयर सेंटर में देने का प्रयास करते हैं। I'll just repeat in a brief in clear Hindi so that if you haven't understood so far, कैंसर के लिए बहुत सारी दिशाओं से एक साथ प्रयत्न करना होता है। उसके लिए डॉक्टर मांकड्स होम्यो क्लिनिक में हम होम्योपैथी तो देते ही हैं, उसके साथ साथ म्यूजिक थेरेपी, संगीत चिकित्सा कैंसर में बहुत इम्पोर्टेंट काम करती है, उसे भी हम देते हैं। उसके साथ साथ व्यक्ति की ऊर्जा को बनाए रखने के लिए और व्यक्ति के आसपास की पॉजिटिविटी को बरकरार रखने के लिए, व्यक्ति के सबकॉन्शियस को पॉजिटिविटी से रिसेप्टिव बनाने के लिए, वो ले पाए, उसके लिए तैयार करने के लिए हमारी क्लिनिक में से डॉक्टर ग्रीवा उनको रेकी, डिस्टेंस रेकी भी देती हैं, क्लिनिक में से पर्सनल रेकी भी देती हैं और रेकी सिखाती भी हैं, ताकि आप ये कैंसर की पूरी स्ट्रगल में से बाहर आ जाएं। और हम डॉक्टर मांकड्स होम्यो क्लिनिक में डाइटरी गाइडलाइंस भी देके आपको कैंसर की परिस्थिति में से बाहर आने के लिए आप कैसा आहार लें, कैसा फूड लें, उस पर भी हम लोग गाइड करते हैं और हम आपके साथ रहते हैं। सो अगर ये सारी चीज़ों को साथ मिला के अगर हमने कैंसर से लड़ लिया, आई एम श्योर 2018 का ये स्लोगन था, कैंसर आई कैन वी कैन। सो इन आर डायमेंशन हम लोग ऐसा कहेंगे कि अगर आपको कैंसर है, वी कैन हेल्प यू। आपको सिर्फ बोलना है आई कैन, इफ यू आर रेडी इनफ टू फाइट विथ योर कैंसर। At Dr. Mankads Homeo Clinic, with all our experience and expertise, we'll be more than happy to help you in the struggle or in your war with the cancer. Thank you very much. Take care.